health and a little wealth and a lot of love. So what is some ways that you can do this naturally?
Yeah, and I will say too, a lot of times we'll order some of those hormone levels, and even if you have some of those symptoms, so we'll order the thyroid function test, and typically it's just a TSH, a thyroid stimulating hormone. It's not a full thyroid panel, which there are some functional medicine specialists that feel strongly about getting a full hormone panel. So not only getting your thyroid stimulating hormone, but also your free T4 and your free T3 and your TPO antibodies.
I don't even know what those are, but I'm just going to imagine that they're in the thyroid.
So your TSH is the hormone that your pituitary produces. So that gland that's kind of within your brain or close to your brain, and it stimulates the thyroid gland to produce thyroid hormone. So the actual hormones that the thyroid produce are the T3 and T4. And the T3 is the active form of thyroid hormone. So that's the actual hormone that enacts activity. And I feel like I'm getting a little bit too much into the detail, but
it's a little. I'm smiling at her, guys, because I feel like it's a lot.
But I say this because a lot of times in traditional medicine, in mainstream medicine, getting a TSH, if the TSH is normal, it means that your feedback mechanism is acting normally, your thyroid function must be normal. But a lot of functional medicine providers will say, well, you need to get the antibody testing. And the antibody testing is because the main cause of thyroid disease is an autoimmune condition where basically your body starts to attack your thyroid gland, thinking it's a foreign invader. And so over time, tissue dies off and you're not producing as much thyroid hormone.
And does that contribute to like weight gain?
Yes. So if you're not producing enough thyroid hormone, then you have potential for weight gain and slowed metabolism. How
hormones impact your weight. That's the whole title of this episode.
And that's only one of them. I mean,
so that's interesting though. But yeah, so for the listeners out there, I mean, we went into some rabbit holes today. But this is really the core of today. So if you are out there and you believe you're exercising, you're getting enough sleep, calories in, calories out, you're doing everything that's just the basic things, and you're still not losing weight, you get your hormones checked, they come back normal, ask the questions to go further.
Well, and this is the thing too. So if you're going to a traditional primary care provider, they're not going to order a slew of testing. And some of that I can understand, but I think the younger patients that we have today, they want to know more. They want to know why.
They do.
And so that's part of the problem that I had with a lot of patients is that, I would try to educate, like, these are the lifestyle changes that you need to make. And you don't necessarily need to order all of these tests because these tests, they're probably going to come back normal anyway. And it's not going to change what you're doing. I'm still going to recommend that you do the same thing. But sometimes those patients want to know specifically, this is what's going on. And that will prompt them to make that change or that life. Like they want to know the information. They want to know the specifics.
Right. Well, I'm going to flip it on its head a little bit. And what I believe is, don't go to this is a wealth mentality. Don't go to your financial advisor and trust them blindly.
Yeah.
And trust your doctor blindly. And
which I'm not saying that either. I'm not saying to go to your doctor and not trust your doctor because they don't want to order all of these intensive tests. But at the same time, as I mentioned, there are certain symptoms where we would definitely order estrogen levels or testosterone levels for females if they had, signs of PCOS or infertility or so if they had abnormal hair growth or abnormal periods or unexplained weight gain or, hormonal acne. There are certain things that would make doctors order those specific type of tests. But I would say there are some other tests out there, which I don't know a whole lot about, and I'm learning a little bit more about because I am trying to do this functional medicine certification just to try to better serve my patients. And There are things called the Dutch test. So there are urine tests that you can get that will not only measure your hormones, but it will give you kind of a pattern throughout the day of how those hormones are changing, increasing, decreasing, interacting
Right.
with each other,
Right.
what your proportions of one hormone to another would be.
Right.
And so to me, those are probably going to be more effective to give you data on how your hormones are functioning rather than doing just the typical serum blood test that you would get at your primary care.
Gotcha.
Because at your primary care, they haven't been trained in it.
Right.
And they also, most of those tests are probably going to come back normal because it's
Right.
not necessarily that the circulating level is not normal. It's that the action on the tissues is what's impacted, or it's
Right.
that the balance that's abnormal.
With a little health and a little wealth and a lot of love, that's the life that we live. Susan Scruggs.